Pautan. Yang salin. Betul lah. Yang ni ya? 29 ya? Betul. 9. Kan nampak konten. Tengok dekat Facebook, dekat web dia announce apa nama link.
Anyway, we're waiting for everything. Somebody else. Yeah, okay, good evening. I didn't know there's so many press as well until today. So thanks for all of you for coming here. First of all, I'll start off by telling you that we are thankful we don't have any cases of Ebola in Malaysia today. The reason why we call this mainly is to inform Malaysians and the Malaysian public on our level of preparedness to face this global epidemic which is happening at this point in time, and to what extent we have put in mechanisms. The National Crisis Preparedness and Response Center, or CPRC, is a center which is continually monitoring the disease surveillance and monitoring of the status of Ebola in the West African countries and other parts of the world, and how we should respond to the spread of this disease. Ebola is a notifiable disease in Malaysia. So far, we have got 9 people who came with fever from Western Africa, mainly from Nigeria, whom we have tested, and they all tested negative. And at the present time, we actually have started screening at points of entry. Points of entry means all international airports, that is KLIA 1 and 2, and the other international airports like Penang, Kota Kinabalu, Johor Bahru, where every person who comes is actually screened for body temperature. And if there's high body temperature, they are taken away and they are being questioned. Otherwise, the next point is all those who come from these countries at the immigration counter. The immigration counter will look whether they have in the last 3 weeks visited any of the affected countries. And if they have visited any of those affected countries, then they will be asked to go to a quarantine area within the airport complex itself. Then they will be questioned as to possible contact with the patient with Ebola. If there is no contact with the patient with Ebola, they will be advised, counseled, and allowed to go. If they have a contact with the patient of Ebola, we have decided to discuss, even if they're asymptomatic, we will put them under supervised quarantine for 21 days. For 21 days of supervised quarantine, and after that, if they are okay, we will say they are safe. So that is for those who are asymptomatic, who come from countries which are affected. For the present moment, that is Guinea, Sierra Leone, and Liberia. Although Senegal and Nigeria had cases before, but they are controlled. And they passed the 42 days of no cases. WHO has declared that there are no more countries of source of infection. So for those who are asymptomatic but with contact, we'll monitor them for 21 days. But those who have contact and are symptomatic, then we will manage them. That means they will be sent to the nearest health facility. And throughout the country, we have isolated 21 hospitals, which will be the initial place for referral, including Sabah and Sarawak and Peninsular Malaysia. for testing and observation. And subsequently, those who are positive, they will be managed in 3 hospitals. One is in Sungai Buloh, one in Kota Kinabalu, Hospital Elizabeth, Queen Elizabeth, and Hospital Umum Kuching in Sarawak. So these 3 will be the designated centers for management. And in the management, of course, we'll follow all the protocols according to the WHO and CDC, where they will be managed in isolation in a single room. They will be taken care of dedicated teams of doctors and nurses who are trained. And all this staff are undergoing training now itself in a simulated exercise that in case it happens, how they're going to handle it, right? Including the infection control processes which we need to do to ensure that there's no spread of disease. If there is a person who is positive and we have reasons to believe they have come into contact with Malaysians, then our surveillance team put a contact tracing for all people who could have possibly come into contact so that we can identify them, examine them, check them for evidence of disease for the 21 days post identifying them. So these are the processes which we have put in. Apart from that, on the global scene, we have already donated about 20.9 million gloves to the affected countries. Today in Cabinet, I also raised the need for further assistance. In principle, Cabinet has agreed that we will continue aiding these countries. I will discuss this further with the Ministry of Finance to find out to what an extent we can further assist them, mainly in the form of provision of more equipment, gloves, gowns, and other related equipment. So we will make a decision of that in the next few days, so we can further give that assistance. At present, we are also assisting the CDC of Atlanta in management of certain data through our tele-network system between them and us. So indeed, in data from the affected countries goes to CDC and through that and to us, and managing this data in advising, surveillance, tracing, and other aspects. We are also studying in detail how we can increase further assistance and support. Okay? Is there any questions you want to ask?
What kind of is it body heat scanner?
Yeah, it's a body heat scanner. So as they come in, I mean, they go on from, it's not only now, we have done this from the days when, was it the SARS? From HN1 and SARS. So from that time, everybody who comes out just before the immigration point, your body temperature is actually screened, and if you have high temperature, then you are identified.
What about health declaration forms? Do all entry points, whether seaport or airports or land, do they have to fill out?
We have, you see, so the most important thing as far as Ebola contact is concerned is their travel of the history of travel, particularly to the affected countries in the last 3 weeks. See, we are concerned with asymptomatic people, those who don't have symptoms. And so we have asked the immigration in our multi-sectoral discussion that they have to look into the passport to see where these people have actually traveled in the last 3 to 4 weeks. And we have evidence in the last 3 to 4 weeks they have actually gone to any one of these countries. Then they will be sent to the quarantine center within KLA. There our health staff will actually go through a questionnaire asking them of their contacts, where they came from, how they feel, and all that. There will be detailed investigation. So the only area is about Malaysians coming back. This is one area of concern which we have. Malaysians coming back from that area, because they won't go to immigration counter, they will go through the auto gate mechanism. So in the asymptomatic, we are thinking of putting up counter gate or before the auto gate, in which they will be given pamphlets advising them if they are coming from these countries, please report so that we can actually monitor them. So that is the one group which we got to manage, particularly the use of auto gate. Okay.
Firstly, since WHO asked for all countries to step up their efforts, what are the additional efforts?
All those things were mentioned, all the efforts.
Additional ones as well.
Well, I think we have, in terms of preparing the staff, getting ready, and of course controls, we have put in all those mechanisms which we necessarily have to do, and it's more or less fulfills most of the requirements.
You have stationed your medical officers at the airports as well?
Yeah, we always had a health teams in the airport. So that team, not only medical officers, public health assistants, and other public health staff who are now involved in this. So they, the moment a person who either has a fever or a person and who has comes from these countries, they go to our quarantine center. The health officers, the health team will actually assist them in filling up the questionnaire and answer questions.
What about the country borders, like coming in from Thailand and Singapore?
Yeah, I mean, in the causeway, it's quite okay. We still have screening in the causeway for those passengers who walk, except those who come by cars or bus. Even those bus, they get down, they have to go through immigration and come. Except for those who go by cars, they don't get down. So that is one small risk in that if they go by car, we might miss that category of people. But in the Thai border, the busiest borders are Padang Besar and Rangkau Panjang. We have told them to put in similar systems in that two areas too. While those areas of weaknesses which we have identified, we are trying to raise how we can strengthen.
So your assets, your equipment, are they state of what?
Human asset, as far as managing, I think we have got enough people who are trained in control of infectious diseases. The head of the infectious disease discipline within the Ministry of Health, Dr. Christopher Lee, is sitting here. He is the one who will take charge of preparing the entire thing. And we have nurses who have been specifically trained in the area of infectious diseases. So these are the people who actually manage it. So in terms, and they are now undergoing simulation exercises in case a real case, how we are going to manage it, including we have run through the whole protocol, including not only the nursing and medical staff, the other components which are associated with it, so that we will be able to actually handle this, including lab testing, transport of lab material, waste management, management of the dead, all those things, so that we can do it in a proper manner.
What about public areas like shopping malls and all that?
That is not an area of concern at this particular point, because as you know, the person under investigation as far as Ebola is concerned is a person who has got a history of travel to these countries and who has minimum there plus of course symptoms otherwise and contact with a person with Ebola. So that is what we are trying to manage by managing the entry point, because that is the most effective way of managing it. So and strengthening it. The other thing is, I mean, all those entry points where there's a chance of these people coming, we want to catch them there, and from there take on the thing. Okay.
What about the Hajj?
Hajj people don't come from this area. So, and either the Hajj areas are not considered as Ebola infected areas. So that is not, but we had one case of COVID before, but they undergo the normal screening for fever, and we have got a very active medical team there itself. to which most of these people actually report to if they've got any problems with health. And that team will look into and help assist us and support whether there's any problems in health from any of the hospitals.
In the Sarawak case, the Zimbabwe students, it's not Ebola case.
No, that's why I have advised medical professionals to actually understand what is meant by a person who suspects Ebola. A person who suspects Ebola, apart from having the normal symptoms of fever, weakness, muscle pain, headache, sore throat, vomiting, diarrhea, or bleeding tendencies, they must have in the past 21 days come into contact with a person, at least gone to a country where there is Ebola, minimum. Further to it, come into contact with somebody who had, either alive or dead. But that Zimbabwe student did not fit into that definition at all. He last went to West Africa 6 or 7 months ago. So he didn't feel, so it was actually because the referral doctor raised the suspicion, we have to go through the entire process to make sure the person didn't have. So he did not fit into the definition. Yeah.
Clearly, with the focus on entry points, target here is to make sure that there are no cases, 0 cases in Malaysia. Can you just describe what is the process if there is a case? Does that change the situation, or even if you manage to isolate it in other?
Yeah, I mean that of course, like management of case in the hospital, I think last Dr. Disability to tell you. Then the management of the other components we will try.
Once the case has been confirmed, as Dr. Sri mentioned just now, the confirmed case will be sent to these 3 designated hospitals in a special pod to make sure the transfer is safe. Once it comes over to the designated hospital, the main thing is we want to give them adequate support treatment. As you know, there's no specific treatment for Ebola yet. A lot of treatment is still very supportive. But the data currently shows that with good supportive treatment, there has been a reduction, a slight reduction in the mortality rate. In the past, people talk about 90% people with Ebola will die. Now it varies now, it's come down from 70%, despite not having a specific antidote or a specific drug. So we want to be fair to the patients as well, to do what's right. However, at the same time, one of our main priorities is to make sure our staff are safe. And I think the cases that's happened in the US, in Dallas, as well as in Madrid, reminds us the risk that healthcare workers take. And we are very, very cognizant of that. We're training them again and again and again to ensure that we are as safe as we can. We are also trying to get whatever appropriate personal protective equipment, PPEs, to ensure their safety is as high as possible. But undoubtedly, there is some risk, and I think all of us here appreciate the nurses and doctors who are serving in this series.
Okay, no more questions. Anything else? We're having a demonstration. Who's doing the demonstration?
Dr. Sri has asked us to do a demonstration of the staff will be wearing the PPEs, various levels of PPEs. They'll go on the stage. Usually on the stage.
A very good afternoon, ladies and gentlemen. So on behalf of the demonstration categories of one is for suspect Ebola or low-risk cases, and the other is for high-risk cases. So for low-risk patients or suspect Ebola patients, staff nurse Rose Honey is dressed in this PPE. What she has is a head cover, goggles, mask, and 95 mask. We do a quick check, make sure there's no air leaks. And then she has the inner gown and apron. She has double gloves, blue outer layer and an inner glove. And then she has shoe covers. Okay, she's not now to enter and treat the suspect Ebola patient. We shall show you the doffing or removal of the PPE. Initially, she has to remove the plastic apron first. As this is the outermost layer, we feel this is the most contaminated area. So you pull from outer surface, roll, and start into a paper waste bin. Alright, now she will remove the dirtiest outer layer of gloves. Started the clinical waste bin, followed by sanitizing her hands. This is done to prevent her from, in case she has breached any infection control practices, we do not want her to carry on to the next step. Alright, now she will remove the blue gown, but you watch the way she does it. She will touch only the inner surface of the blue gown, because the outer surface is not fully covered. So to prevent any contamination of her hands, we remove it from the inner surface.
Kau dongakkan je. Ni okey lah.
It takes time to don and doff the personal protective equipment. Our staff have been trained repeatedly, and we always emphasize on taking time, not rush, contaminate, or breach infection control practices. That's the key message. Alright, now she will sanitize her hands. Okay. Now she will remove the head cover. To remove the head cover, she has to bend forward slightly. Bend forward slightly, lift the inner surface, lift the head cover over the head. Alright. So all the time touching the inner surface. Now hand hygiene. As you can see, it's tedious. Next, she will remove her goggles. Touching only the side and not the front. Hand hygiene. Next, the mask. So pull. Hand hygiene. Remove the boot covers or shoe covers. So she has to stand apart so that the inner, the leg on the right, the inner surface, that is the outer surface of the cover, does not touch the straps. She touches only the outer surface of the boot cover or shoe cover. So in our hospital, we have a railing where they can hold to balance themselves. This is a very tricky step. Sometimes if you do not balance yourself well, you can fall. We wipe down the railing every time we go in, personally disinfecting the railing for safety issues. Okay, yeah, the leg. Good. Every step has its take your time, every movement is calculated. There's a third person in the empty room watching your every movement. You'll be given a signal if you are about to breach infection control practices. Now remove the dirty glove. Sanitize hands. She's ready to go have a bath and change to fresh scrubs. So this is just for a suspect patient. Dr. Marisman. So every time you see the patient, you have to dot and dot this. Takes time, time consuming, it's tiring. Okay, ladies and gentlemen, this is for high-risk patient. This is the first PPE or personal protective equipment that we use. You can see it's an outer Tyvek suit. This is water resistant, impermeable to water. Goggles. Underneath this Tyvek, he has a head cover, and then he has an N95 mask. And he has double layered gloves, just like this now, and boot covers, as well as boots inside. Now, I need to explain to you, most of the breaches in protocol is during removal of personal protective equipment. Therefore, we stress, never touch the outer surface of your PPE. Always aim to go for the inner surface, that is the cleaner surface. Right? So we shall now demonstrate the doffing or removal of PPE. Time consuming again. So to start with, he will remove the dirtiest. This is for a confirmed Ebola patient. So these patients will be like they will be vomiting uncontrollably or having a lot of diarrhea. So the dirtiest layer would be the boot covers. That comes off first. Watch, he only touches the outer surface of the boot cover because this is the dirtiest layer. He will remove this first. Alright, now that he has removed the dirtiest layer, this glove is contaminated, the outer glove, the dirtiest glove, that comes off next. He will use a beaking method. This is a method where we prevent self-contamination during glove removal. He pinches, he points, he uses the inner surface to then cut the other glove. And only inner surface and inner surface comes in contact. Alright, now sanitize your hands. Now he will unzip his Tyvek suit. He will hold the tip and unzip right down. Next, sanitize hands. Watch him as he lifts the hood off his head. He only approaches it through the inner surface. Very gently lift the hood and push it to the back. Yes. Sanitize your hands. Now, the tricky part, removing the sleeves. You will remove the left sleeve first. Use your hand, enter through the inner surface and push the left sleeve and pull your hand through it. All the way, yes. Okay. So he's only holding the inner surface. Now, he will sanitize his hands. Because he's going to touch the inner surface on the right side for the right sleeve. Okay? Now remove the right sleeve. Very good. All the way out. Yes. What he does next is he rolls this Tyvek suit right down to the ankle from inside out. The reason we do this, The outer surface is contaminated, so we roll it inside out so that we do not contaminate our hands in the process of doing so. All the way down. The Tyvek food is very bulky when you roll it down, it takes a bit of time. Alright, now remove the Tyvek food one leg at a time. You can hold. You have a handrail for them to hold. Alright. Now proceed to sanitize your hands. Alright. Now remove the head cover. Again, slowly from the inner surface, lift it up. Alright. Start. Sanitize your hands. Sanitize your hands. Okay, remove your gloves. Sorry, your goggles. Remove goggles. Now, sanitize hands again. Proceed to remove the mask. The mask is removed outside the patient's room. Okay. Alright, now remove the glove. It's not done yet. One last step. Remove the boots. This is another tricky step. Yes, to remove the boots and set into the props. There is a red zone in the anti room. Okay, beyond that point, the boots can't travel. Alright, so ladies and gentlemen, we will now proceed to have his bath and change to fresh scrub. So as you can see, it's a very tedious process, it takes time, every step is measured, your movements are calculated, there is a third person watching you, we try to be as safe as possible. Thank you.
Now, I think the last week or so with these nurses, one in Madrid and two in Dallas, who were affected looking after two very ill Ebola cases. It highlights the importance of how healthcare workers are at risk. This is Dr. Anisha and my friends demonstrated the doffing, the taking off of the baju, because as you highlighted, it's the highest risk. It's not just the wearing, it's the taking off of the protective equipment. So I think it was very important that we showed the tedious steps that we have to do to make sure we remain safe. To do this, to make sure we don't make a mistake, breaches of protocol, we have a minder, a third person or second person who's watching you take off piece by piece of your protective equipment. So that in case we make a mistake, and sometimes human beings can make a mistake, he will stop you there and then, so that you do not breach a protocol. So it is very labor intensive, as you can see, it took a long time to take off these things. But I think there's no substitute for safety. We have no option. Nothing much. Okay. Thank you very much. Bye.
Dah. 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 Hentikan